Unit 9A, Threats to Nutrition, Hepatitis. What is hepatitis? Hepatitis is defined as the widespread inflammation of liver cells. It can have many causes, including exposure to toxic agents, bacterial infection, autoimmune disease, and some hereditary diseases. The most common causes seen in the clinical arena are viruses and alcohol. Progression of hepatitis will vary slightly based on the etiology of the disease, but the basic process begins with exposure to a causative agent. The liver then becomes congested, and as a result of inflammation. If we were to look inside the liver when it is fully involved in this process, what do you think we would find? Inflammatory cells, lymphocytes, and fluid. Those products of inflammation cause enlargement of the liver, and as the disease progresses, there is discomfort progressing to outright pain. Where would the client feel the pain? Well, your right upper quadrant is where the greatest mass of the organ is found. As the disease progresses, the liver's normal lobular pattern becomes distorted due to widespread inflammation, necrosis, and hepatocellular regeneration. What do you think that means, hepatocellular regeneration? The body tries to heal the damage, but normal liver tissue is replaced with scar tissue during the regeneration process. What's the problem with scar tissue? It doesn't function like normal tissue, so consequently, pressure goes up within the portal circulation, and that interferes with blood flow into the hepatic lobules. There is edema of the liver's bile channels. Can you guess what that would be? Intrahepatic obstructive jaundice. Hepatitis can either be acute or chronic. Acute viral hepatitis, which occurs in the initial period after infection, will have symptoms that are very clinically similar to all other viral types. Symptoms can range from subclinical asymptomatic infections to fatal acute infections. Chronic active hepatitis or chronic aggressive hepatitis. With this, the disease is defined as chronic whenever it persists for longer than 6 months. It might follow behind an acute viral hepatitis infection. It might follow behind liver damage, patchy necrosis, fibrosis of chronic liver disease, contributed to liver failure and cirrhosis. Death will occur within 5 years of onset. Fulminant hepatitis, also referred to as fulminant hepatic failure. While this is a variant form of hepatitis, it occurs in about 1% of infected people, mostly those who have hepatitis B or hepatitis B with concurrent hepatitis D infection. It can be caused by toxic medication and chemicals, metabolic disturbances, or structural changes that alter the liver function. Usually develops within 8 weeks after the first symptoms of jaundice. Complications that is characterized by aggressive progression of the disease, rapid deterioration, and marked liver necrosis. Fulminant hepatitis is potentially reversible, and some clients do survive. However, acute liver failure can result if the liver is unable to regenerate. About 60 to 80% of these cases will end with the client's death. There are about 6 definitely identified forms of viral hepatitis: A, B, C, D, E, and G. Viral hepatitis is usually caused by RNA or DNA viruses, but it can also be caused by other viruses such as Epstein-Barr, yellow fever, herpes simplex, varicella zoster, and cytomegalovirus. However, those other causes are rare and are usually considered separate disorders. Types B, C, and D are known to extend into chronic form. Types A and E are not associated with chronic disease. It is not yet known if type G can actually extend to chronic form. The existence of type F is somewhat controversial, and research continues to solidify identification. Hep A, formerly referred to as infectious hepatitis, is caused by an RNA virus from the enterovirus family. It's transmitted by the ingestion of food or fluids infected with the virus. Sources of infection include contaminated water, shellfish caught in contaminated water, and food contaminated by food handlers that are infected with the virus. It is also subject to sexual transmission. The incubation period is estimated to be between 15 and 50 days, with a mean of 28 to 30. The disease is usually not life-threatening, but it can be prolonged, lasting about 4 to 8 weeks. It tends to last longer and be more severe in clients older than 40 years of age. It rarely progresses to the fulminant form. Hep A has a mortality rate of 0.5% for those under 40 and 1 to 2% for older people. If the client has underlying chronic liver disease, morbidity and mortality are increased in the presence of Hep A. The virus is present only briefly in the serum. By the time the client displays jaundice, they are likely to already be non-infectious. Many people have had hepatitis A and are unaware that they even had it. Clinically, very similar to any gastrointestinal illness, and recovery is usually uneventful. Many clients have no jaundice and other symptoms. When symptoms do appear, they resemble those of a mild flu-like infection with a low-grade fever. Anorexia is an early symptom, and when it does happen, it is often severe. It is thought to result from a release of toxin by the damaged liver, or from failure of the damaged liver cells to detoxify an abnormal product. Later, jaundice and dark urine may occur. There is ingestion in varying degrees. Nausea, heartburn, and flatulence can be signs of indigestion. The client may also develop a strong aversion to the taste of cigarettes or the presence of cigarette smoke or other strong odors. These symptoms tend to clear as soon as the jaundice reaches a peak. That's usually about 10 days after the initial appearance. Symptoms can be mild in children and more severe in adults, who may also have a more prolonged disease course. Assessment findings often include a moderately enlarged liver and spleen for a few days after onset. Other than jaundice, there are few other physical signs. Diagnostically, we can test for HAV antibodies that would be detectable in the serum, but usually not until symptoms appear. The virus can be found in the stool 7 to 10 days before illness and for 2 to 3 weeks after symptoms appear. General precautions are the best prevention. Scrupulous hand washing, safe water supplies, and proper control of sewage disposal are a few important prevention strategies. Vaccination. Hep A vaccine was approved for use in 1995. It is 94 to 100% effective after 2 to 3 doses. It is believed to provide 6 to 7 years of protection against the infection. At this time, there is no country that recommends universal vaccination against Hep A, but it is a mandatory vaccination for infants in certain states in the U.S. Anyone that is traveling to locations where sanitation and hygiene may be suspect should consider the vaccine. Vaccination is also recommended for those in high-risk groups, such as homosexual men, IV or injection drug users, staff of daycare centers, and healthcare personnel. It should be noted that for adults it takes a 2-dose administration over 6 to 12 months, and for children 3 doses over the same time period. So this is not something that can be done at the last minute. Immune globulin. For people who have not been previously vaccinated, Hep A can be prevented by IM injection of immune globulin during the incubation period, as long as it is given within 2 weeks of exposure. Globulin can provide 6 to 8 weeks of passive immunity. Immune globulin is recommended for people who live in close proximity or have had sex with someone who has Hep A, because susceptible people in the household are usually infected by the time diagnosis is made. Daycare and restaurant workers with exposure to or infection by Hep A, and anyone who has not had the vaccine but is traveling to a high-risk area should consider prophylactic treatment. Management. Bed rest, diet, and dehydration prevention managed at home. So for this one, the way to remember it is, A is for apple. You get it from food. Fecal oral transmission. Hepatitis B. This form was once known as serum hepatitis because it is primarily a blood-borne pathogen. It has been isolated from virtually every body fluid and tissue. It is transmitted when blood or body fluids from an infected person enter the broken skin or mucous membranes of someone who isn't immune to hepatitis B. It can result from sexual contact with an infected person, from having multiple sex partners, men having sex with other men, IV drug use, having a job that involves contact with human blood, being a patient or worker in a home for the developmentally disabled, having hemophilia, living in the same house with someone who has a lifelong hepatitis B infection, or traveling to an area where the disease is common. An alarming cause that is on the rise is the improper disposal of used needles, as more than 9% of them are contaminated with hepatitis B or C. Sharing toothbrushes, razor blades, or other personal items with an infected person can also result in exposure. Side effects. Hepatitis B attacks the liver and can cause lifelong infection, cirrhosis, liver cancer, liver failure, and even death. It's a major cause of cirrhosis and liver cancer worldwide. Symptoms. These are the same as previously discussed, but just as with Hep A, as many as 30% of infected people will have no symptoms. About 90% of people with Hep B will develop antibodies and recover completely within 6 months. The other 10% will progress to chronic hepatitis or will become carriers and remain infectious for the rest of their lives. There are an estimate of 1.25 million Americans who are chronically infected with Hep B, and 20 to 30% of those contracted the disease in childhood. The good news is that the number of new infections has declined since the Hep B vaccine was introduced. Treatment. Well, clients with active hepatitis B are treated for 4 to 12 months, usually with a combination of interferon alpha and antiviral agents such as Epivir and Hepcera. Medication management. The client should be advised to report any significant adverse effects of interferon: fevers, chills, anorexia, nausea, malagrasias, fatigue, alopecia, and infection. Interferon can also cause depression, so the client needs to be screened carefully for depression before beginning this therapy. If the client is severely depressed, they should not receive this drug until their depression is under control. Symptomatic reactions. The healthcare provider should be watching closely for symptomatic adverse reactions, such as bone marrow suppression and thyroid dysfunction. Prevention. It is very important preventative measure of hepatitis B is the hepatitis B vaccine. Most children under the age of 18 are routinely vaccinated. Anyone who is at high risk, such as healthcare workers, should also be vaccinated. Those who play or work in inner city parks and playgrounds are at high risk from carelessly discarded litter containing needles and syringes. They should be vaccinated along with men who have sex with men, IV drug users, and anyone who travels to areas where infection rates are known to be high. Patient teaching. If the client is positive for Hep B, they should not donate blood, organs, or any tissue. And of course, they need to avoid taking any drugs that affect the liver. A good way to remember this one is B is for blood and body fluids. Hepatitis C. Transmission. It is transmitted in blood and body fluids, just as with Hep B. Other risk factors are people who received clotting factors that were made before 1987, got an organ transplant or blood prior to 1992, receive hemodialysis, maternal fetal transmission, and multiple or infected sex partners. Someone at high risk for hepatitis C is also at risk for hepatitis B and HIV. Virus has been detected in breast milk, but transmission is rare as it takes a very high titer in the mother in order for the infant to contract the disease. Pathophysiology. The problem with Hep C is that the virus mutates rapidly, and at any given time there are many active variations of the disease. A person can even be infected with more than one variation at a time, and each variation may respond differently to treatment. We have identified more than 10 subgroups of Hep C. The effects. Well, approximately 75 to 85% of infected individuals will experience chronic infection, and 70% will have chronic liver disease. Hep C is the number one indication of liver transplant. 3.9 million Americans have been infected with Hep C, and 2.7 million of them are chronically infected. How do we diagnose it? Well, unfortunately, it is difficult to diagnose because 80% of those infected will have no symptoms, or if they do develop them, it may be years after the initial infection. Blood tests may show antigen as soon as 4 weeks after infection, but it can take up to years for levels to become adequate enough to be detected. How do we treat? It is treated with combination drug therapy that is dependent upon the genotype of the virus, but will include some form of interferon plus another agent. Within the first 12 weeks, we can know how the client will respond during the entire 48-week course of treatment. The other treatment option is a liver transplant. Unfortunately, most transplanted livers will eventually become infected as well, but by altering lifestyle and avoiding risky behaviors, recipients can improve quality and quantity of life. Prevention. The constant mutation of the virus effectively blocks all efforts to develop an effective vaccine, so prevention remains the best medicine for this disease. We want to teach clients what behaviors to avoid and make sure that you always use standard precautions when caring for clients. For this one, you want to remember C is for chronic, the form most likely to become a chronic disease in the client and most likely to lead to liver cancer and death. Hepatitis D. Pathophysiology. The virus needs the hepatitis B virus in order to duplicate. So the client cannot have hepatitis D without having hepatitis B. The outer coat of hepatitis D consists of hepatitis B surface antigen around a single strand of RNA virus. This co-infection may lead to acute or fulminant hepatitis. Modes of transmission are similar to hepatitis B. However, sexual transmission of hepatitis D is less efficient than for hepatitis B, and perinatal transmission is rare. Interferon for this form of the virus is currently being researched as a form of treatment. Prevention is dependent on hepatitis B prevention, since Hep D is dependent on Hep B. So since it's a co-infection, if you prevent Hep B, you will prevent Hep D from the client getting it. A post-exposure vaccination for Hep B can also prevent Hep D. There isn't anything that will prevent a person who already has B from getting a superinfection of Hep D on top of it. Patient education. It is very important to educate clients who have chronic Hep B from avoiding risky behaviors that could lead to hepatitis D superinfection. So one of the main ways to remember this one would be that D is for depends on B. So you can't have D without B. Hepatitis E. Occurrence. The virus has been responsible for acute hepatitis outbreaks in Asia, the Middle East, Africa, and Mexico. It isn't common in the United States, and cases seen here usually are the result of travel to endemic areas. Modes of transmission will occur from drinking contaminated water. The incubation period averages 40 days, and most cases seem to occur in young middle-aged adults. Severity of the illness increases with age. The death rate for hepatitis E is 1 to 3% for the general population, and 15 to 25% in pregnant women. There have been no known cases of chronic infection with Hep E. The effects are again typical signs and symptoms of other forms of the disease, but they may also display some uncommon symptoms such as pruritus and urticarial rash. Infection with Hep E is diagnosed when a person presenting with active hepatitis symptoms is negative for other types of hepatitis, especially when there is a history of travel to an endemic area. There is no real treatment for Hep E. The client can be given supportive therapy measures only. In this case, immune globulin from Western donors has not proven effective in preventing infection. It is not known if immune globulin preparation from donors within the endemic area would be more effective. To help prevent Hep E infection, educate the client to avoid drinking water or beverages with ice in areas with uncertain water quality. They should also refrain from eating raw shellfish and avoid raw produce unless they prepared it with purified water. E is for environmental, and you get it from the water in the environment. Hepatitis G. Well, you might be wondering what happened to hepatitis F. The story is that after strands A to E were identified, there were a few cases that didn't fit in anywhere else, and they were labeled hepatitis F. Over time, researchers realized they couldn't isolate hepatitis F as a separate disease, and that in fact, the so-called hepatitis F cases were really just mutations of hepatitis C. But by the time they had already found and identified hepatitis G, it was too late to change hepatitis G to hepatitis F just for the sake of alphabetical order. So now there is a gap between hepatitis E and hepatitis G. The occurrence has been detected and reported in blood samples in Eastern Europe, Asia, and Australia. Transmission occurs when tainted injectable drugs, tainted blood, organs, or tissues are received, or when unsafe tattooing or body piercing occurs. It can be passed from mother to child during the birth process, but exact rates of transmission are not known at this time. The effects of hepatitis G can cause persistent viremia that lasts for several years. An interesting side effect of hepatitis G is that because it produces certain cytokinins, it actually slows the progression of HIV infection into AIDS. To date, we have no vaccine or specific treatment for this form. G is for global, So the best way to remember is that it is found in other parts of the world. So G is for global. Chronic hepatitis can lead, most people can lead fairly normal lives. Even if infected at a young age, they can still expect to reach adulthood. To reduce the effects of the virus, the client should utilize general methods of good health. Eat a healthy diet and limit red meat, avoid alcohol, no illicit drug use, get adequate rest, no smoking, regular exercise, and manage stress. The client may be prone to nausea, so treatment is going to be indicated for symptomatology, and if so, must take extra care to eat a healthy breakfast, as symptoms may worsen as their day goes on. If they are being treated with ribavirin, and immune globulin, they must use 2 forms of birth control, one for each partner, to help prevent pregnancy, because this treatment is associated with a high incidence of birth defects. Oral contraceptives may be ineffective because the liver may have problems breaking down oral estrogen, so other forms of birth control should be utilized. No intercourse during menses, as this increases the risk of transmission to an uninfected partner. Maternal indications. Infected women who want to breastfeed should have their titers monitored. It is essential for them to prevent cracked nipples, as this can expose the child to infected blood. When nipples are cracked, the mother should pump her breast to avoid contaminating the milk with blood. Women infected with a hepatitis virus may have irregular periods. They may skip a month or more of their periods, and they may be also shorter. Proper disposal of used sanitary items is essential to prevent transmission of the virus. If the woman has severe liver impairment, she may have heavy and prolonged menses, especially if she cannot produce sufficient clotting factors. Psychological indications. Infected clients may have emotional issues to work through, including depression or guilt. Depression needs to be discussed with their health care provider to explore possible treatment. Fear of death and loss of control can be common during the acute phase of illness. Also, fear of infecting others may cause self-esteem problems and isolation from family and friends. Help the client discuss these fears and concerns and identify appropriate methods of coping with these realistic concerns. Nursing interventions. Assess the client carefully for signs of activity intolerance, nutrition imbalance, anxiety, fear, deficient knowledge about their disease, and risk for infection and injury. Advise the client to avoid medications that affect the liver, such as non-steroidal anti-inflammatories or acetaminophen. Make sure the client is aware of signs and symptoms that could indicate a new infection. He should also know how to maintain his fluid and electrolyte balance and record his daily weight. During hospitalization, monitor frequency and quality of the client's stool and teach him to do the same at home. Encourage him to take rest periods during the day as needed. If he has a substance abuse problem, refer him to appropriate supportive organizations, such as Alcoholics Anonymous and Narcotics Anonymous. Also refer him to the American Liver Foundation website, where he can learn more about living with hepatitis. New methods for detecting and treating hepatitis are always under investigation, but risk of exposure to healthcare workers remains very high. Be sure to receive available vaccinations and always use standard precautions to avoid contact with hepatitis pathogens.